Well, good morning, everyone, and welcome again to another live this morning. Start of another week, start of a series of podcasts. Good morning, everyone. Hopefully everything is good. Annette and Francis and Michael, Jeanette, good morning to you. And Maureen, nice to have you on. Susan and B, good to have you on. Nativity and Helena, John and Elaine, Jerry. I like to say hello. Ginny and Marin, good morning to you. Veronica from Texas. Jeanette, good to have you on. You guys are great. Thanks for coming on this morning. Big crowd. Wow. Nick and Lorene and Nicole and Annie and Joy. Linda. Okay, I'll go in. Lieb, good morning to you. Anita, listen to this study, guys. Madeline, how are you? Susan, good to have you on, guys. Okay, so I will go on afterwards and say hi to everyone. I wanted to read this study to you. A recent study on the effect of A1C, the dietary effect on A1C. Now, do you guys know what A1C is? Actually, many of you have sent to me your blood work. And you know where I come from. I'm always interested in your triglycerides. I'm interested in your HDL. All cholesterol is good, but HDL in particular because of its function within the stream. I'm very interested in your A1C. Your blood sugar, but A1C is better because it gives you a range. And let me explain, okay? So A1C is what they call glycolated hemoglobin. What is that? Okay? So, guys, listen. Every time you breathe, your red blood cells go by your lungs. Your red blood cells go by your lungs. Your red blood cells have a very sticky substance called your hemoglobin. Okay? And oxygen, when you breathe, oxygen attaches to your hemoglobin. Okay, so you got it? So every time you breathe, your red blood cells have that sticky substance called hemoglobin, and oxygen attaches to it. Now, when you do an A1C, okay, glycolated hemoglobin, you know medicine, it loves big words. What's that mean? Glycolated hemoglobin is when sugar attaches to hemoglobin. Sugar attaches to hemoglobin inside the red blood cell and it sticks to it for the life of the red blood cell. The red blood cells, you get brand new blood every 4 months. Okay? So 3 times a year, you get brand new blood. Your body's always making new blood, but a red blood cell only has a certain lifespan. And what A1C measurement is the measurement of glycolated sugar. When you ever see the word glycation, think of sugar. Because sugar, we've talked about this in the past, and I don't want to spend too much time there, but just a minute. Sugar, it does a lot of bad things, as you and I know. One of the things it does it glycates. It glycates your cells. It glycates your tendons. What's that mean? Glycation is like, it's sort of a hardening. It's a loss of elasticity, and it damages. Glycation is a form of free radical damage. Okay? So in free radicals, you have oxygenation and you have glycation. Glycation damages cell walls, it damages tissue, it damages blood vessels, and we call that AGE, aging, age. Okay? Advanced, glycated, okay? End products. Again, it's always big words. Don't get too hung up. All I'm trying to say is when they measure your A1C, it's a much better measurement than you just taking your blood sugar, or even when the doctor takes your blood sugar. Okay? Because what A does, it's a period of over 2 or 3 months. And they get an average because they watch, it's a test where they are able to check the red blood cell and the hemoglobin and the sugar that's attached to it. So, having said all that, I want to bring you to the study that just came out. A study showed there's only one diet. There's only one diet that lowers your A1C. There's only one that lowered your A1C consistently over a period of time. Only one. And you're not going to be surprised by this, but I'm going to tell you the results of the study. There were 4 diets were compared. One, the vegetarian diet. Okay. Number 2, the vegan diet. Number 3, the American diet for diabetics, brought to you by the American Diabetic Association. They threw in their recommended diet guidelines. And then fourthly was the low-carb ketogenic diet. Guess which one won? Only one was able to do it. And folks, listen, I'll give you the answer. You already know it, but I'm going to give you the answer. The answer was the ketogenic diet, the low-carb diet. Now, if you've been following me for years, and many of you have, I've been very consistent on how to lose weight, how to keep weight off, what's best for your insulin, because insulin is a food hormone. And one of the ways to measure insulin, there's another way to do it, but generally, insulin, A1C is the one I like, is one I like. I really do. It doesn't necessarily tell you about insulin resistance at 100%, but it's probably one of the best tests that doctors do to show you insulin resistance. And remember, all diseases of insulin start with insulin resistance. Okay? Start with insulin resistance. So, okay? Now, when you look at the 4 diets, isn't this interesting? And it's why I always come back to, I always come back to that low carb diet. Why, Dr. Martin? Why do you like low carb so much? Because it works. I'm aiming specifically at your insulin. Your insulin. And what A1C does, it really shows you, because that sugar is attached to the hemoglobin in your red blood cell, and they look at the life of that red blood cell, and they can get a good look at it. Guess what? It gives you a very good measurement. Now, let me just give you a couple of measurements that I look for in A1C, okay? Because you would ask the question, and I will post this afterwards in the Martin Clinic Facebook group, okay? Like, what do I like for A1C? Well, first of all, it will not get flagged if you're over 5.7, okay? If your A1C is over 5.7 to 6.5, 6.4, in medicine's eyes, that is pre-diabetic. Anything over 6.5 in A1C is diabetes, according to medicine, according to the American and Canadian Diabetic Associations. That's the number they like, but that's not the number I like. Because I'm going to tell you something. If your number is over 5.7 A1C, you are already a diabetic. Even if you're not classified as a diabetic as far as the American Heart Association or the Diabetic Association, or even your doctor, it doesn't matter. You are a diabetic. I tell people, look, if you got 5.7, you're diabetic. You're on the Titanic already. You better get off of it. So you see what I'm saying? So it's very important to keep that number. So look, if your doctor, ordinarily they will do it, especially if they're doing an annual test. But if you're not sure, when you get blood work done, just ask your doctor, because it won't cost you anything to ask your doctor to make sure they do an A1C test. I like A1C. It's like I like triglycerides and HDL. I really like looking at that number. I like looking at your B12. If you can, get your vitamin D levels done too. Your plasma vitamin D, which is dehydroxy 25. Okay, you don't even tell the doctor. Ask the doctor. And you know, some of them resist, but they won't resist A1C. I can't see it. Okay? Because it's a really good test to have done. So now let's go back a little bit to the diets that don't work first. And then I'll tell you why a low-carb diet works. Okay? So, you know how many people have told me in the last month even, how many people have told me that they're vegetarians? Even online here, like, Doc, I used to be, I had a lady on the weekend in on our web, not on the website, as they were on our Facebook group, and they said, I used to be a vegetarian, you talked me out of it. Best thing I ever did was talk you out of being a vegetarian. Okay? Now, for many reasons. Okay? And then, how many of you have even grandchildren or children that are vegetarians, or even worse, vegans? They're vegans, meaning they don't have any dairy either. They won't have dairy. They don't have cheese. They just have, they have fruits and vegetables and grains and rice. But you know what? One of the reasons I'm talking them out of it is, one of the reasons, of course, is they're missing a lot of nutrients, okay? They're missing a lot of nutrients, including B12. It's impossible to get B12 from the vegetable kingdom. It's impossible to get cholesterol from the vegetable kingdom. It's not in there. So a vegetarian who eats some cheese, at least they're doing that. They can get vitamin K2, and they can get, they're getting some dairy, but they're not getting B12 because B12 is only found in red meat. They're not getting heme iron, H-E-M-E. There was a truck parked beside me yesterday, and it had a Hemi engine, H-E-M-I. Sort of been made famous by Dodge, the Hemi engine. But it's the iron that you need in your body is H-E-M-E, heme iron. And heme iron is found in red meat. It's not found in anything else. So that was one reason that I always try to convince people, even though this is very popular today, very popular is indoctrination. I call it indoctrination. It's like a religion. They teach, they're not supposed to be teaching religion in the schools, the public schools, but they do. They do teach religion. They teach climate change. I believe that's religion. They teach veganism, vegetarianism. That's indoctrination. That's a religion, folks. And I could tell you the long history of vegetarianism. It came out of the Seventh-day Adventist. Who was a Seventh-day Adventist? Dr. Kellogg. Yeah, the cereal people. Now listen, I'm not knocking the religion. I'm just telling you a little bit of history. I'm telling you a little bit of history. But one of the reasons I always emphasize that being a vegetarian or vegan is not good for you is what you're missing in those diets. But this morning, I want to emphasize a second reason, and that reason is insulin. It's insulin. A1C, if you want to lower your A1C, your glycated hemoglobin, that's glycated by sugar. A sugar molecule attaches to the red blood cell. And if your A1C is too high, you are a carboholic. It's as simple as that. And vegetarians and vegans will not lower your A1C. That is significant, guys. This is a finding that is very significant. Because I've always talked to you about the number one reason is what's missing in those diets. Amino acids like L-carnitine and L-arginine and L-taurine, they're not in those diets. They're not there. I've always emphasized that. What's missing? But this morning I want to emphasize what it does to your A1C, your blood sugar over a period of time, and your insulin. This study proved it conclusively that only a low-carb diet, only a low-carb diet will lower your A1C. A low-carb diet. Why have I set up the reset? Now listen, guys, way before the reset, I was talking low-carb. I wrote a book in The New Thin You. Was a low-carb diet. Atkins talked about low-carb diets in the 1970s. He was a cardiologist. He wasn't a dummy. And by the way, Dr. Atkins did not die of a heart attack. He died because he slipped on ice coming out of his clinic in New York City, and he hit his head on the ice, and he never woke up. Yeah, that's how he died. you got people, oh, he died from his diet. No, he didn't. Guys, you know where I come from. Eggs, meat, and cheese. Why? You have everything in there. Point number one. Everything is in there. Somebody said to me the other day, oh, Doc, you don't have any potassium in there. Sure you do. You got potassium in there. There's potassium in meat. There's potassium in eggs. There's potassium in cheese. You got it all, man. I'm even getting you to add salt, because salt's good for you if you use the right salt. But you want to lower your A1C. See, I'm aiming at lowering your insulin resistance. Why? Because insulin is a growth hormone. Insulin, over a period of time, will elevate your inflammation. And inflammation, left unchecked, will damage your blood vessels, damage your cells. And this is why there is a direct line between your insulin and heart disease, your insulin and cancer, your insulin in Alzheimer's, type 3 diabetes. That's what they call it. And 4, diabetes. And 5, autoimmune. Insulin. There's only one way to lower your insulin. It's not medication. It's not metformin. I mean, you can do it with meds, but eventually, you know, you're out of luck, man. Eventually your cells respond even to medication. It always amazes me that diabetics that don't change their diet. Well, as a matter of fact, the guidelines given to, it's incredible. The guidelines given to diabetics by the American Diabetic Association and the eating guidelines of the Canadian Diabetic Association will not lower your A1C. I can't get over it. They're still teaching it. They're teaching you'd never want a diabetic, guys. You never want a diabetic to be a vegetarian, ever. You never want a diabetic to be a vegan, even worse. the very foods they need to fix their problem are eggs, meat, and cheese. If a diabetic never, ever had another piece of bread, they would only help themselves. If a diabetic never had another bowl of cereal, any cereal, name the cereal for me, from oatmeal to shredded wheats or whatever, they would only be doing themselves a favor. They'd only be doing themselves a favor. I'm telling you, it's amazing to me how there's so much misinformation out there. It's amazing to me. There isn't a diabetic that cannot reverse their diabetes if they eat properly. They can put their diet, okay, somebody said you're talking about a cure. No, you're only cured as long as you eat properly. So it's in remission. You never talk about a cure for cancer either, do you? Oh, I'm cured. Nah, you're not cured. You're in remission. You fight cancer every day. Every day you fight cancer. Every day you fight diabetes. Every day. If you give up on the diet, okay? Now, I'm not saying you can never cheat. I'm not telling you that. What I am saying is you cannot give up on a low-carb diet. That's why, Dr. Martin, see this face? I'm always emphasizing lifestyle changes. The reset is to get you on a new lifestyle. And this is why it's so successful. It's not yo-yo dieting. It's not a trick. Oh, geez, I lost weight. Because all these weight loss programs, all of them, are not talking about what your body needs. So I want to lower your risk of everything. I want to lower your risk of everything. By going low carb. And actually for 30 days, you're doing a no carb diet. Oh, Dr. Martin, how am I going to live without my carbs? Well, you'll find out that your body is thrilled. Is thrilled to live without carbs. And there's a lot of reasons for it because we don't live in the same world that we used to live in 50 years ago. High fructose corn syrup is up 300%, the consumption of it. And you and I have been surrounded by foods that are very, very, very hard on your insulin. And by the way, I didn't even give you the number I like. I like your A1C to be below 5.4. For me, personally. That tells me pretty well that if you're below 5.4, not 5.6, at 5.4, you're doing really well, and even lower than that. But 5.4, anything above that, it's too high for me. It's putting you into that diabetic range. And I'm not necessarily a big guy on the word pre-diabetic, because we overuse that. Pre means, oh, I'm not a diabetic yet. Yet you are. You're a diabetic if you're pre, in my opinion. Okay? So isn't this study fascinating that the only one that can lower your A1C and lower your insulin is not a vegetarian diet, it's not a vegan diet, it's not the guideline of the American Diabetic Association guidelines diet? The problem with diabetic associations, they still believe in carbohydrates. Oh, you need to eat a balanced diet. Well, not if you're a diabetic. And that word balanced is overrated. For years, I always told my patients, variety is overrated. Oh, I get so tired. I heard that the other day. I get so tired, Doc, of eggs, meat, and cheese. Well, suck it up, Buttercup, first of all. And second of all, you know what? I was, talking, Rosie and I were talking the other day. I've been eating bacon and eggs since I was a kid. I'm not tired of bacon and eggs. I'm not tired of sausage and eggs. I'm not tired of coffee. I've had coffee every day of my life. For the last 55 years, at least. I can't think of a day that I didn't have coffee. Well, like somebody said, don't you get tired? I never get tired of coffee. Are you kidding me? You know what variety is, they say it's the spice of life. Nah, not in this day and age. So I tell people, look, there's a lot of ways you can make different eggs, meat, and cheese, but eat eggs, meat, and cheese if you want to be healthy. If you want to lower your A1C, it's the best way to lose weight too. It really is. So that's science, guys. It's science. And I know there's a lot of controversy to it, but it's only because people have an agenda. And I think they mean well. I do. I'm not saying they don't mean well, but they have an agenda. So out of the 4 diets to lower A1C, only one did it. Only one did it. And that's the low carb diet. And the best one, I can guarantee you, I highly recommend as you do the reset. Thousands and thousands and thousands of people have done it. It's amazing. It's amazing. The results are consistently good. And so I push, because it'll fix your A1C. And because it's the best diet for you. Okay, thanks for watching this morning. If you have any questions, send them in to the Martin Clinic Facebook group or save them for Friday. And you can send that in, just send them to Brandy. And just say this is for Friday, and Friday is question and answer Friday. Okay? So once again, we'll have a great week of great topics, and we sure appreciate you folks watching. We appreciate that you've invited your friends and continue to invite your friends and family into our private Facebook group. Huge crowd in there and very, very good topics, and people bring up some good stuff and a lot of good feedback in there, and we just love that. We really do. Okay, so love you.